Okay, we're going to start with the MCL valgus at 0 and 30 test. So first of all, I'm going to find the joint line here. And we'll do it at 0. And I'm just assessing for any movement. And then we'll do it at 30 degrees of flexion. And then for the LCL, so varus force, again finding the joint line and then applying the force at 0 and 30 degrees. Good. And I would do that on all these tests on both legs, but just for the time of the video, I'm just going to do them on one leg. So now we'll move on to the ACL test. So I will start with the anterior drawer. So for that one, I'm going to have the patient flex their knee up. And I will sit on their foot a little bit and have them make sure they're relaxed. And then I'll put my thumbs on their tibial plateaus and pull the tibia anteriorly and assess if it's excess anterior translation, and that would be indicative of an ACL tear. Next is Lachman's. So this one, I'm going to put my knee under their knee, make sure they're relaxed again, and I'm going to stabilize the femur, and then I'm just going to pull up on the tibia, and again assessing for any anterior translation. And then the last ACL test is the pivot shift. So I'll have them flex up to about 90 and make sure they're relaxed. And then I can internally rotate the lower leg. I'm gonna internally rotate this way. And then I'll extend the knee and add a valgus stress. Okay, good. And then the next ones are PCL tests. So first is the posterior sag test. So I would stabilize their lower leg here, and then I'd be looking for their tibia to be sagging posteriorly. And then the other PCL test is the posterior drawer. So I can do that one here. I can stabilize up at the femur, and then I can put a posterior force and assess for posterior translation. And then meniscal tear tests. The first one is McMurray's. So for this one, I would flex the patient all the way up, and then I can start adding internal and external rotation with that. And then depending on which one creates their symptoms, it would be either a lateral or medial meniscal tear, and then I can also start adding valgus and varus stress too. Good. And then for the other meniscal tear test, you can lay on your stomach, and can you scoot towards me more, please? You're going to bend your leg up like this, and I can use my knee here to stabilize, and I'm going to pull up on their leg and distract and internally and externally rotate their lower leg, and then I will also compress. So push down, internally, externally rotate, and then it would be more pain with the compression. Okay, you can go back to your back. And then the next test is patella dislocation. So is for patella dislocation, which is the patella apprehension test. So this one, what I would do is I'd just be watching the patient, and then I would grab their patella and just laterally glide it and see if they were apprehensive at all. So if they didn't want me to move it, might be a sign that they've had a patellar dislocation. And then The patellofemoral pain test is the Clark's test. So this one is where I get a good grip on the superior part of the patella, and then instruct the patient to do a quad sit. So squeeze your quad for me. And then if they have pain with that, okay, relax. Then that would be a positive test. Maybe. And then for effusion, it's the Blotman test. So for this one, push down and then push up, and then keep the pressure there, and then you tap on their patella, assessing for effusion if there's a tap. Okay, and then the last test is for IT band, which is the Noble compression test. So for this one, I would find their lateral condyle of their femur and go a little proximal to it. And then I would extend them and really pay attention at 30 degrees, because that's where the IT band changes the action, and it can get pretty tender there. So assessing if they have any reproduction of symptoms. Okay, and that's it for the knee.